With Bass at Integrated Health Solutions, and today we're going to talk about fascia. So we're going to go over what is fascia, sort of what does it look like, what's its purpose in the body, what happens when it has adhesions or scar tissue throughout it, why that happens, and like how it can affect you, and then we'll also go over how to get rid of it in various ways. So fascia is something that comes up a lot in treatment plans because it can happen with a chronic injury, it can happen with a traumatic injury, which is any kind of repetition. So a repetitious job that you do over and over and over again. You might get scar tissue. I mean, it could be something as simple as you played college volleyball and you have scar tissue along your forearms from like just repeated contact with the ball over and over and over again. So first let's go over what fascia is. So fascia is a connective tissue. So a soft tissue in the body. It has a lot of collagen fibers in it, a lot more than muscle fibers. And its purpose is sort of to maintain our shape and also to give strength. So it ends up turning into tendons and labrums and more harder tissues. But it starts out as a pretty thin tissue that covers different types of muscle fibers. So for example, your quadricep is 4 different muscles. Each one has sort of its own wrapping, if you want to call it like that, of fascia, and then there's a wrapping that goes over all of it together, and at the end when it comes off it ends up turning into your patellar tendon. The fascia kind of coeses together and ends up turning into your patellar tendon. So that's sort of what it does. And like tell if you have tension in your fascia. One, it can contribute to stiffness, overall stiffness of joints and just stiffness in muscles. If you have muscles that get tight, you stretch them and it comes back. Sometimes the reason that it keeps coming back is tight fascia. So it's like the outer covering of the muscle is still very tight, and so it reproduces that tight muscle relatively quickly after you get it worked out. If you're looking in a specific area like the bottom of the foot or the abdomen, you can just check your skin and how fluid it moves. So if you take a piece of skin, you should be able to move it kind of up and down and side to side. If there's a certain way that the skin doesn't want to go, like a resistance to pull in one direction, you might have some fascia pulling you in that direction. You also see it very commonly with any kind of scar. So anybody who's had any kind of abdominal surgery, including a C-section, you get kind of like a pucker across the scar line. So it's adheres to the layers underneath. And again, if you grab that tissue and try and pull it up or in either direction, any direction, then it's gonna resist you, okay? And that's a sign that the fascia is kind of adhered down through the layers. Now that obviously isn't something that you wanna do with any kind of a fresh scar, but a scar can be 30 years old and you can still affect it with soft tissue work and some of the things that we're going to talk about today. So one of the things I want to go over today is different ways that you can release fascia that's tight. So the ones that we use here the most, we do soft tissue work, which can be by hand or what they call instrument assisted. There's different kinds of gua sha or surgical stainless tools that you can use to kind of like scrape and get stuff to let go. It kind of feels crunchy, for lack of a better word, when you're doing it. So it's kind of how you can tell that there's some fascia there. You can foam roll, you can use a massage gun, you can have a deep tissue massage. Dry needling is very, very excellent and works really well for getting rid of tight fascia. What doesn't work is stretching, unfortunately. So if you have tight hips and you're stretching all the time and you feel like you're not really getting anywhere, you just hit a wall, you potentially have some fascia there that needs a more aggressive take on it, because just stretching it isn't going to get rid of it. Just not going to be enough. I also want to go over kind of how it feels in the body. So you can generally tell when it's fair because you have a lack of smoothness in the tissue. So if you have a muscle that runs this way and you press along in the same direction and you have bumps or crunchiness or just a resistance to pushing it in general, then you might have some fascial tension there. We're usually only paying attention to it when it's also going with a lack of mobility or if it's causing pain. But sometimes it can be a cause that you just don't even realize is connected. So if you've had any significant trauma, surgical scars, or tension that you feel like doesn't abate with a really good amount of stretching, like it's just not enough, you might want to look into fascia and try some of these techniques at home to alleviate it. If you have more specific questions, please feel free to reach out and follow our channel for more information.